Hi everyone, so today we're going to be talking about aortic dissections. And basically an aortic dissection occurs when the inside of the aorta basically rips apart and blood is able to get under a part that we call the tunica intima. We'll talk about that in just a minute. The good thing about aortic dissections is even though they can be extremely dangerous, they're not very common. So let's take a look at these. And the first thing I'm going to do is we're going to draw the heart. I'm going to draw the heart like this. And this is as if you're looking at the heart on a person who's facing you this way. So just like my right arm is on my right side, the right side of the heart is over here. So blood comes into the right atrium, it goes down into the right ventricle, it then goes out to the lungs, it comes into the left atrium, and then it goes down into the left ventricle. Now coming off of the left ventricle, we have our aorta. Okay, and what the aorta is going to do is it's going to come out, and now it's going to curve around, and it's basically going to go kind of back behind the heart and then down into the body. We have some blood vessels that come off of here also. And these are going to play a role in just a minute in helping identify aortic dissection. So this is going to be my aorta that's right here. This whole area in here is my aorta. So for what it's worth, these arteries are going to go to the brain and out into the arm. But the one that I'm most concerned about is this one right here. And this is called my left subclavian artery. Now, the reason I'm concerned about this one is there's two types of aortic dissections. The first type can be a type A aortic dissection. This is the more common type, and it's also the more deadly type. If the dissection occurs before the left subclavian artery, that's when we call it a type A. If it's anything after this, we call it a type B. Type A aortic dissections will usually require surgery to fix them. The most common place to get it is a few centimeters after the aorta leaves the heart. So I've seen some books that say 2 centimeters. I've seen some that say 10. So we're going to say somewhere around 10 centimeters. Just between 2 and 10 centimeters, which is going to be about 4 inches up. The reason for this is because as this left ventricle pumps and it's pumping blood into here, this left ventricle has to pump hard enough to get blood basically all the way up into the brain as well as throughout the body and to get blood back into the body. So it has to pump with a lot of force. What happens in aortic dissection is as that pumps, what's going to happen is that blood is going to come and it hits the blood vessels on the aorta as it comes out. And so what can happen over time is we can actually cause damage to the lining of the aorta, which we'll talk about in just a minute. And so that's what's going to happen in aortic dissection. So let's go ahead and take a look at this real quick. And on a blood vessel, you have 3 layers. So here's the first layer. And we're going to call this layer the tunica intima. Okay, and the tunica intima is a thin layer and it's the innermost layer. Then after that, we have a layer that has muscle in it, and it's the thicker layer or thickest layer. And this is called the tunica media. Now this contains muscle so your blood vessels can contract and relax, and it controls the size of the blood vessel. So we have that layer there. And then on the outside, we have, let me just put tunica media. Okay, and then on the outside, we have the tunica adventitia. So let's go like this. And again, what you're looking at right here is as if we were dissecting a blood vessel. And so these are the layers of it. So remember, we're looking at a round tube-like structure here. So this is my tunica adventitia. Okay, so now, right here, this part here is where the blood flows. So this would be called my lumen. The lumen is the opening of a blood vessel. So, and here's my red blood cells inside my lumen, okay? Now imagine my left ventricle is pumping blood into here, and I happen to get some weakness on my tunica intima. So I have the blood that's pumping from the left ventricle, and it keeps pumping and pumping, and over years, eventually what happens is this tunica intima starts to weaken, and we get a tear. Okay, so now I've got a tear in my tunica intima. Well, what's going to happen now is as the blood pumps out of that left ventricle, some of the blood is now going to come in through this tear that's right here. And as it does that, the blood is going to get between the tunica media and my tunica intima. I just say lumen. It looks like it says lumer. And so the blood is going to start to build up in here. Okay, and as the blood goes in there, it eventually continues to tear this apart as it's going up in here. And this is my aortic dissection right here. So now I basically, dissection means to cut open or cut apart. I've basically dissected this now. It's in two pieces. And this will continue, the blood will continue to build up in there. Now, two things can happen here. One is I may get another tear further up, and it's going to come out, and it goes back into the bloodstream. Even though it may not look like it's that big of a deal, it still is. We don't want this, okay? And by the way, just so you know, now that it's gone in here, we call this part a false lumen. Okay, that's called a false lumen. And so the blood can continue to build up in here also. And as it continues to build up in here, what it will actually do is it'll actually start to push this part out also. So now I can get some bulging in there too, which is not good. So imagine it's going like this now. All right, and I still have my tunica media there. All right, and then I have my tunica adventitia, which is there. Okay, and the other thing too is as this builds up, it could also cause the blood to also come this way a little bit too. Okay, in my false lumen. So now I'm getting blood all in here. All right, so as you can see now, this can start to become a problem, and it can actually hold quite an amount of blood. So it can start to affect the body's function in other areas too. So if you look though, as you can see, I have my aortic dissection now. I got the blood that's between the tunica intima and the tunica media, and as it's pushing this way, we call that propagation. All right, and this part here would be called my exit tear. So let's take a look now of who gets this. All right, so if we were to look, this is a condition that is more common. I'm just going to move my camera over here. So if we were to look at this, well, first, if we were to look at this, who gets this? Okay, first of all, it affects men over 60. And the reason being is that because as men get older, or as we get older, our blood vessels start to weaken. So men over 60 are more likely to get it. It's more common in people who use drugs that stimulate the heart or that increase the blood pressure. So you may see this in cocaine users. The other people who may get it are women who are pregnant because now they're having to pump blood for two. So it may occur in pregnant women. Okay. It may also occur in people with hypertension. As we know, when someone has hypertension, what it does is that also weakens the blood vessel. Along with that is also when people have atherosclerosis. Okay, and as you know, atherosclerosis is also going to weaken my blood vessels. Sometimes it can occur when someone's doing high intensity weightlifting. It can also occur due to trauma. Okay, so there's a few conditions that can actually cause, another one is an aneurysm. If someone already has an aneurysm. The reason being is because this is already weakened, so an aneurysm can happen too. Okay. Okay, so as you can see, this is the people who are most likely to get these. Let's talk about symptoms, and now I'm just going to move my camera right over here, and let's talk about symptoms from this. So what can happen in this, the symptoms that people can get, is a lot of times they're going to feel like a tear, like something's torn inside their chest. So there's a tearing sensation. Okay. Let me put a tearing sensation in the chest. Because the blood is actually going into this lumen here, the false lumen, sometimes people may not have much of a pulse in one of their arms. So you may get a decreased pulse in one arm. All right, the other thing that can happen too is it may mimic a stroke. People may have loss of vision. They may have loss of speaking. So I'm going to put stroke-like symptoms. All right, and I'm also going to put, and this is kind of obvious, it mimics a heart attack. Okay, and we call a heart attack an MI, or myocardial infarction. Okay, the other thing that can happen is the person may become unconscious. All right, so the person may become unconscious. So that's some of the symptoms from this, and then it is a life-threatening condition. One of the things that can happen too is that the blood vessel may actually break open and the blood may start to leak out too. So that's basically it for an aortic dissection, and I hope you enjoyed the video. Thank you very much.